Today topic of discussion inborn errors of amino acid metabolism. Amino acid metabolisms disorder are autosomal recessive disorders. It is an autosomal recessive disorder characterized by inability to metabolize some amino acid due to mutation of some gene. Inability to metabolize of some amino acid due to mutation of some gene encoding the enzyme leading to buildup of these amino acid which can be toxic. So leading to buildup of these amino acid which can be toxic. Some of the amino acid metabolism disorders are discussed below. So what are the amino acid metabolism disorders? First one is phenyl ketonuria. Second one is Tyrosinemia, Hartnup disease, Alkaptonuria, glycine encephalopathy, maple syrup urine disease, cystinuria, homocystinuria, cystinosis, isovaleric acidemia. These are the 10 important disorders we want to discuss. What are the things? Phenylketonuria, tyrosinemia, Hartnup disease, Alkaptonuria, glycine encephalopathy, maple syrup urine disease, cystinuria, homocystinuria, cystinosis, isovaleric acidemia. We want to discuss one by one. Inborn error of amino acid metabolism. First condition, phenylketonuria. It is an autosomal recessive inborn error of phenylalanine metabolism. Autosomal recessive inborn error of phenylalanine metabolism which is occur due to mutation of PAH gene. Leading to deficiency of that enzyme phenylalanine hydroxylase. So mutation gene PAH, deficiency of enzyme phenylalanine hydroxylase. Phenylalanine is an essential amino acid that is obtained through diet. How we can get through diet? The PAH gene provide instruction for making enzyme. So this gene only provided information for making the enzyme phenylalanine hydroxylase which help in converting phenylalanine to tyrosine or other important component in the body. So phenylalanine is the essential amino acid we obtained from our diet. PAH gene only provided instruction for making enzyme phenylalanine hydroxylase which help for converting phenylalanine to tyrosine and other important component. Due to the deficiency of this enzyme, phenylalanine is not metabolized in the body. So because of absence of this enzyme, phenylalanine is not metabolized in the body and hence it get build up in the blood. So it get build up in the blood and tissue leading to toxicity. So not metabolized, so it reach to blood. Not metabolized in the body, so it get build up in the blood. After that it will causes tissue damage leading to toxicity. Blood and tissue leading to toxicity. The nerve cells in the brain are very sensitive. The nerve cells in the brain are very sensitive to the excess phenylalanine level and can cause us brain damage. Infant with phenylketonuria appear normal until they are few months old. Signs and symptoms include intellectual disability, seizures, delayed development, behavior problems, skin disorder like eczema, lighter skin and hair, and mouse like odor. Treatment consists of controlled phenylalanine restricted diet. Controlled phenylalanine restricted diet. So this is all about phenylketonuria. Second, inborn error of amino acid metabolism, Tyrosinemia. Tyrosinemia is an autosomal recessive inborn error which occurs due to the mutation of various genes leading to deficiency of enzyme needed for tyrosine metabolism. By various enzymatic reaction, tyrosine is broken down in the liver, resulting in molecules that are excreted in the urine or used to produce energy or make other substances. The deficiency of enzyme. What are the enzyme? Fumarate acetoacetate hydroxylase. So deficiency of enzyme like fumarate acetoacetate hydroxylase, tyrosine aminotransferase, 4-hydroxyphenylpyruvate dioxygenase, 4-hydroxyphenylpyruvate dioxygenase, which occur due to mutation of gene FAH, TAT, HPD respectively. What are the gene? FAH, TAT and HPD, resulting in the it will disturb breakdown of tyrosine. So these are the gene mutation disturb the tyrosine breakdown. This leads to accumulation of tyrosine. So metabolism is disturbed. So this one leads to accumulation of tyrosine and it is byproduct causing damage and death of the cells of the liver, kidney, nerve system and other organ. So this tyrosine and its product causing damage and death of cell of liver, kidney, nerve system and other organ. Next, types of tyrosinemia. It having three types: type 1 tyrosinemia, type 2 tyrosinemia, type 3 tyrosinemia. Type 1, it occur due to mutation of fumarate acetoacetate hydrolase. Fumarate acetoacetate hydrolase gene which encode that enzyme. Name is called fumarate acetoacetate. Encoding enzyme name is called fumarate acetoacetate, resulting in the accumulation of fumarate acetoacetate in proximal renal tubular cells. So fumarate acetoacetate accumulate in proximal renal tubular cells and hepatocytes. The sign and symptoms benign in the first few months of alive. There is growth retardation, diarrhea, vomiting, jaundice, cabbage like odor, increasing tendency to bleed, liver or kidney failure, liver cancer, rickets, changes in mental state, reduced sensation in the arm and leg, and abnormal pain. Second one is type 2 tyrosinemia, result from mutation of tyrosine aminotransferase, TAT, mutation of tyrosine aminotransferase gene which encode that enzyme tyrosine aminotransferase, which result in the accumulation of tyrosine in eyes and skin. Sign and symptoms begin in that early childhood. There is redness and pain in the eyes. Redness and pain in eyes, watering of eyes, photophobia, palmoplantar hyperkeratosis, and some of them manifest intellectual disability. Next, type 3 tyrosinemia condition result in that mutation of hydroxyphenyl pyruvate dioxygenase, resulting in mutation of hydroxyphenyl pyruvate dioxygenase gene. Mutation of hydroxyphenyl pyruvate dioxygenase gene which codes the enzyme 4-hydroxyphenyl pyruvate dioxygenase, which code for enzyme 4-hydroxyphenyl pyruvate dioxygenase. It result in intellectual disability and neurological dysfunction. Then it is the rarest of the three conditions. Treatment include providing low protein diet, avoiding meat and dairy product, and food rich in protein. Providing adequate vitamins and minerals can help the children to grow normally. So, provide adequate vitamins and minerals. In case of severe liver transplantation may be needed. Next condition, inborn error of amino acid metabolism. Hartnup disease. Hartnup disease is an autosomal recessive disorder caused due to mutation of gene SLC6A19, SLCXA19 that provide instruction for making a protein called amino acid transporter. This protein is found embedded in the membrane of intestine and kidney, and it helps in the transport of various amino acid into the cell. The deficiency of this protein leads to decreased absorption of amino acid from the intestine and the kidney. The deficiency leads to decreased reabsorption of amino acid, leading to their excretion in the urine. These amino acids play an important role in various functions of body, which includes production of certain vitamins and protein. The amino acid affected include tryptophan, alanine, asparagine, glutamine, histidine, isoleucine, leucine, phenylalanine, serine, tyrosine, valine. So these are the things these are the amino acid also affected. These amino acid play a major role in various functions of our body, including production of some vitamins and protein. Amino acid affected. These are the amino acid are affected. Symptoms differ from person to person, and it is usually seen in children between the age group of 3 to 9 years. The symptoms include red, scaly, sensitive rashes on the skin, then cerebral ataxia, seizure, tremor of hands and tongue, then emotional instability. Some children experience growth retardation. Treatment include providing niacin and protein rich food. Providing niacin and protein rich food, supplement of niacin, then avoiding the triggering factors like direct exposure to sunlight, then sulfonamide drugs, physical and emotional stress. Next condition of inborn error of amino acid metabolism, Alkaptonuria. Alkaptonuria is an autosomal recessive disorder that occurs due to mutation of HBD gene, which encode for that enzyme homogensitate 1,2 dioxygenase. Homogensitate 1,2 dioxygenase needed for the metabolism of homogenistic acid. Metabolism of homogenisic acid. Homogenisic acid is derived from tyrosine or phenylalanine through catabolic pathway. Derived from tyrosine or phenylalanine through catabolic pathway. Urine of affected individual is abnormally dark or terms dark on long exposure to air. So the urine of affected individual abnormally dark. This is deposition of homogensitate in that connective tissue, especially the cartilage. Here deposition of homogensitate in connective tissue, especially in cartilage, which turn blue or black or gray in color. The bone become weak. Joint become inflamed and painful. There is discoloration of tendon which is visible through the skin. Cardiac valve also affected. Kidney and prostate stone may be occur. Kidney and prostate stone may occur. The treatment include symptomatic treatment. For example, inflammatory drugs can be given in the case of joint pain and inflammation. Physiotherapy can be advised. High dose of vitamin C can be given. High dose of vitamin C also given. It is found to prevent deposition of homogensitate in the tissue.